Benefits of exercise for osteoarthritis. In general, the advice for osteoarthritis is for exercise to be incorporated as a core treatment. And this is irrespective of age, comorbidity, pain severity, or disability. Exercise should include local muscle strengthening and general aerobic fitness. It has not been specified whether the exercises should be provided by the NHS or whether healthcare practitioners should provide advice and encouragement for the person to obtain and carry out the intervention themselves. Exercise has been found to be beneficial, but the clinician needs to make the judgment in each case to make sure that it's effective for that particular participant. This would include assessing the person's individual needs, circumstances, self motivation, and availability to local facilities. When we look at benefits of exercise, we are looking at a few different elements, and one of those is the physical side of things. So, physically, it improves bone and muscle strength and increases the stability around our joints. It improves flexibility, and therefore we increase the amount of movement that we have within these joints. It improves cardiovascular fitness and helps to reduce and control our blood pressure. And alongside a healthy diet, it can help us maintain our weight. It reduces the risk of certain diseases such as coronary heart disease, strokes, type 2 diabetes, and some cancers. As we're improving our strength and our balance, it reduces the risk of falling, and these all help to increase our function. So, being able to tackle things like going up the stairs and getting off the floor easier. Another important element of the benefits of exercise is our psychological side. So, this improves mood by releasing the chemicals known as endorphins. It can improve our confidence as we begin to feel fitter and stronger, helps maintain brain function and allows us to think clearly, and then also it improves our sleep. And finally, it helps us to keep our social side nice and strong as well. It maintains our independence and it allows you to meet new people if you're doing things such as group exercises. And most importantly, exercise should be fun. Anyone can do exercise, no matter what your age or how things are going for your condition and your pain. A lot of things already count as exercise that you're probably doing already, but wouldn't think of it as exercise. Research has shown that people with joint pain and stiffness experience reduced symptoms if they're more active. Naturally, if we do not exercise, muscles will become weaker, joints stiffen, and causing our symptoms to worsen. Exercise recommendations. So, in general, when we're talking about exercise, we're looking at about sort of like 30 minutes. So, this can be done within short bouts or all in one go. How often are we looking at? So, this should be done over most days. So, in general, we're aiming for about 150 minutes per week. How much effort you should be feeling and whether you know you're exercising. So, you should be feeling slightly warmer. You should feel that your heart is beating that bit faster, but you're still able to talk. So, this could be something like a brisk walk. Other parts that you're probably already doing that you wouldn't necessarily count as, oh, I'm exercising, is things like going for a walk, gardening, and stair climbing. Exercise recommendations. So, when we're looking at knee and hip arthritis, we're looking at low impact cardiovascular exercise. So, this will help with keeping the joint cartilage healthy and improve that quality of synovial fluid within the joint. So, we're moving more fluidly. And we're looking at about 30 minutes or more several times a week. Resistant training. So, these will help to keep the joints nice and strong and well supported. So these are tailored for that specific joint. And this should roughly take about 10 to 15 minutes a few times a week. And stretching. So, stretching we would like everyone to aim to do most days and, if possible, every day. And it should be done vigorously over the course of about 10 minutes. Regular exercise as a whole will help you keep healthy, not just physically, but emotionally and socially as well, and help you manage your pain.